Welcome to the Not Old Better Show Prevention Magazine Healthy Living interview series on radio and podcast. The show covering all things health, wellness, culture, and more. The show for all of us who aren't old, we're better. Each week, we'll interview superstars, experts, and ordinary people doing extraordinary things, all related to this wonderful experience of getting better, not just older. Now, here's your host, the award-winning Paul Vogelzang.
Welcome to today's episode of the Not Old Better Show Prevention Magazine interview series brought to you by MDHearing and TalkSpace. Today's program is where we dive deep into the intersection of healthcare and cutting-edge technology, specifically the role of artificial intelligence, known as AI, in transforming the landscape of medical care for individuals over 60, really all of us. As we navigate through this age of digital medicine, AI has emerged as a beacon of hope, promising to enhance the accuracy of medical diagnoses through advanced image interpretation, even helping with some invoices. Yet, as we stand on the cusp of this new era, questions and concerns about its integration into healthcare, especially for the elderly, abound. Today, we're joined by renowned health, science, and medical writer and award-winning novelist, returning guest, Meryl Davids-Landau, who will guide us through this fascinating world of AI in healthcare. Meryl Davids-Landau has written a recent article in Prevention Magazine about the subject of AI and healthcare, and today we will explore how AI is reading test images with unprecedented accuracy, potentially revolutionizing the way conditions are diagnosed. However, it's not a panacea. The technology comes with its own set of challenges, as Meryl Davids-Landau will report. There are ethical considerations too, regulatory hurdles, and the nuanced issue of how some AI-driven interventions may not always be recommended for older adults, stereotyping many. Our conversation with science and medical writer and award-winning novelist Meryl Davids-Landau will not only illuminate the capabilities and limitations of AI in healthcare, but also what it means for you, our listeners. As we delve into this topic, we encourage you to think about the implications of AI on your health and well-being, particularly in advance of your next visit to your primary care physician or medical professional. How can you engage with your healthcare providers to better understand the role AI might play in your care? What questions should you be asking to ensure that the technology serves your best interests? Join us today as we unpack these questions and more, offering insights, expertise, and thought-provoking discussion with our returning guest, Meryl Davids-Landau. All of this designed to empower you to take an active role in your healthcare journey in the age of AI. Your health, your decisions, your life in the digital age are evolving. Let's navigate this brave new world together. Hey everyone, we will be right back with our interview with Meryl Davids-Landau on AI and healthcare. But I wanted to take a moment to share a personal experience with you all. I mentioned our sponsor today is TalkSpace. There have been times in my life, certainly recently, when I felt really down. And it's affected me in various ways. I knew that talking to a therapist would help me. So I didn't know where to start. You know, part of being down and blue is you're just in such a funk, you don't know the steps to take. And it's hard to take some of those steps because you're just not thinking clearly. I wasn't. And I discovered TalkSpace, frankly. TalkSpace made it easy for me to find a therapist that I liked. And the best part is that I can meet with them online from the comfort of my own home. If you're like me and think seeing a therapist could be beneficial, but you struggle to find the time or the funds to make it happen, then TalkSpace is the perfect solution for you. By offering therapy sessions online, TalkSpace has made mental health care accessible and affordable for everyone. It worked for me. Why wait on some of these things? Now that you've heard this message, jump on this. Don't wait for something bad to happen to seek help. Therapy can help you shift your perspective. That's what it did for me. It helped me find some coping tools that I was lacking. It also can be a a guiding light in some of these difficult times. With TalkSpace, you can sign up online and get matched with a personalized therapist, typically within 48 hours. It happens really fast. Plus, you can send messages to your therapist between sessions. Really helpful to me. TalkSpace is the #1 online therapy platform with licensed therapists in over 40 specialties. It's secure, private, and compliant with HIPAA regulations. And the best part is that TalkSpace is affordable and in network with most major insurers. So why wait any longer? Getting started is the most important step. As a listener of this show, you can get $80 off your first month with TalkSpace by going to TalkSpace.com/NOB. All of this will be in our show notes. You enter the promo code SPACE80. That's space, SPACE 80. Again, all of this in our show notes. Take the first step towards better mental health today and show your support for the show. That's TalkSpace.com/NOB. Use promo code SPACE80. You need this. Please check into it now. Meryl Davis Landau, welcome back to the program.
Thanks. Great to talk to you again.
It's also our third conversation. So I say this because I am so appreciative, and the audience is too. You're very popular, and your work is so important. I think this subject that we're going to talk about today, AI and healthcare, based on your upcoming article in Prevention Magazine titled "Hello, Dr. Roboto." I love that name. All of our audience will remember, of course, that wonderful song. I think by Styx. I think Dr. Roboto was by Styx. But in any event, I don't mean to digress. Good to have you back. I hope you're well, and so nice to talk to you. Let me just jump right in and just.
I can't actually take credit for the title of the article. That was the editor.
Okay, well, they do a good job at prevention. Yeah, yes. Yeah, and so I'm appreciative of all of that too. So with respect to AI, it certainly is here. It's everywhere. We're seeing it on the news. Where I live, it's a factor in the Defense Department decisions. There are financial decisions that are being made based on AI, and it is everywhere. It's also has this gigantic potential within healthcare. And I wonder if you just start by sharing your sense of where this all is with respect to AI and how it's being integrated into healthcare, and how some of the examples that you've come across really show that it's leading to some transformation, not just a bunch of hubris, not just a bunch of just grand claims, but some outcomes.
I think the thing I was most surprised about when I started researching this piece is how much AI is already being used in healthcare. Everybody hears about AI is coming and it's going to transform things. And so I expected the article to mostly be about what's coming in the future. Mm-hmm. But a lot of things are already using AI, and probably most prominently is imaging, right? So AI is helping doctors to read scans and other imaging. It's being used mostly in testing, but still affecting patient care, to take notes for patients. And it's being used in various hospitals and medical centers around the country. Like, for example, Kaiser Permanente put AI in 19 of its hospitals. And it was a test. It was a study. It wasn't, they weren't using AI in place of any doctors or other treatments, but they were trying to see, because of so much data that comes in to the nursing staff when people are inpatient in a hospital. And it's very hard for the nurses and the doctors to kind of know which patients are really getting into trouble before they really get into a health crisis. And so they used AI to sift through all of the vital signs and nurse reports, the medical history, all the factors about every single patient in the hospital. And then AI helped to flag the people who needed their treatment looked at more closely. And in fact, in the study that they published about this, they found that over 3.5 years, 520 lives were saved.
Wow. That
they think otherwise these patients would have died in the hospital. So I think, there's really tremendous promise for AI. There's already being seen effects of AI. And of course, there are concerns about how AI might be used and some of the problems that we hear about in society, writ large and in healthcare as well.
Well, thank you for that. And let's talk about a concern or two, because I think many in my audience will think, based on the title of the article, Dr. Roboto, that there isn't a human involved, that there's just simply a machine that is making some of these decisions that might raise ethical concerns. So tell us some of the concerns that you came across and maybe dispel this myth about human involvement, because clearly humans are involved.
Well, humans are currently involved, and of course that's the ideal scenario, is that AI plus doctor is much better care. And research is showing that much better care than AI alone or doctor alone. You put the two together, you're getting better care in many cases. But there is a concern that, hospitals could potentially, or medical centers could cut back and say, low-income patients, or if you don't want to pay this amount to talk to a doctor, then you're relegated to the AI bot. I mean, like we see that in banks, right? I mean, if you don't have a certain balance, sometimes you're sent to the computer program instead of the live voice, right? So there is that concern for sure, that medical care could become bifurcated and only people with more money would have more access to physicians, and other people would be sent, to the AI systems more often. But also there's a concern about bias, right? So AI gets all of its data from human note-taking, human documentation. It's only teaching itself what's already out there. And so we all know in medical care, there's a lot of bias, right? There's bias against older people. There's bias against Black people and women, in terms of understanding their symptoms, listening to them, recommending certain treatments. So all of that bias could get back into the decision-making that AI is using. So that definitely is a big concern. And one, people in the space are watching out for, but right now there's really no fix for that.
The idea, because you're suggesting this, that the note-taking, the teaching of the AI machine, the AI bot, is forming this kind of collective, for lack of a better term, going kind of back to Star Trek's Borg scenario. That I don't mean to make light of this at all, but this is kind of the idea that it's taking. And we've heard about this. New York Times bestselling authors are complaining about their books being, kind of consumed in this process and spitting out on the other end an AI bot of an author's work. That's not really what's happening, but in some ways, all of this note-taking is going into this big database and shaping AI's efforts with respect to healthcare, as well as its deployment. Do I have an understanding of it correctly?
Well, so again, that part's kind of in the early stages. But one of the great promises for AI is how much data is out there, right? So you have in a hospital system, you have decades worth of patients who had certain test results and had certain treatments and had certain results from that. All of that documented in the historical record there somewhere, but most doctors are not looking at that when they decide what's best for you. What treatment should you have? But the potential for AI is to mine all of that data and then be able to sort of say, these treatments work well for these patients. But all the bias of history in terms of which patients are offered access to certain treatments and all of the other, systemic racism and bias against elderly people or whatever who are not offered certain treatments just because they're older, even if they're in good health and could potentially do well, right? All of that is baked into the records and therefore could come to play a role down the line. And also one of the fascinating things that's currently being deployed in some institutions is what they call ambient listening. So the AI is sitting there during your appointment with your doctor. I mean, it's sitting there on the tablet or the phone app or whatever, right? But how you go into the doctor's office, the worst thing about going to the doctor's office these days is the doctor sits there facing their computer, typing their notes the whole time. They're not looking at you. They're not interacting with you. Like that old-fashioned conversation is long gone. And so the idea behind this ambient listening is that the doctor can, again, turn their attention to you, and the AI is just recording everything, not recording verbatim, but recording like a smart stenographer recording all of the different things that are discussed during the treatment. And then the AI, number one, can produce a summary for each patient at their reading level in their native language in 2 seconds, right? Produce this for this Spanish-speaking person, who only got through 8th grade, would be a very different summary and recommendation languaging than somebody who's an English speaker with higher education or a French speaker or whatever. So, but the doctor's past history of your notes would also play a role in that. And if the doctor thinks, I'm not going to recommend that treatment for this person because they're elderly, that's also playing a role in those notes. So that's where all of the bias from, historically and contemporary in the medical system could get into the process, and will get into the process, and is getting into the process. But, hopefully as we move forward with AI, some of that will be recognized and worked on and fixed.
To what extent is that being worked on and fixed even right now, kind of real time? Is the American Medical Association, for example, involved in some of these regulatory decisions with respect to AI and its development and its deployment in healthcare? Are there other, maybe governmental, FDA or so on and so forth, bodies involved in kind of shaping some of this? Where do we stand? Because it's happening very quickly. The pace is really moving.
It is happening very quickly, and obviously all of those groups are trying to make sure that AI is used as ethically and as fairly and as correctly as it can be. The American Medical Association introduced the principles for using AI, again, but these are just principles. Federal government is also trying to make sure that AI is used in a way that benefits people instead of harms them. But probably from a healthcare perspective, the biggest check on improper uses of AI would be that the FDA has to improve all technology related to healthcare, including AI technology.
Hey, everybody, it's Paul. We will be right back with our interview on AI and healthcare with Meryl Davids-Landau. But I mentioned that today's show is sponsored by MDHearing. MDHearing is an FDA-registered rechargeable hearing aid that costs a fraction of what typical hearing aids cost. MDHearing's Neo model costs over 90% less than clinic hearing aids. This became very important to our family recently, and it's changed my family's life for the better. This transformation made it very clear that we had an issue with her hearing. We got it tested, and MD Hearing Aids really came out on top. The brand that's not only giving the gift of sound to my mom, but also a connection to all of us. Let me take you back to this recent Thanksgiving. My mom, who's always been the rock of our family, had started to withdraw in silence, her world quieting down, I suppose, with age. But this year, thanks to the MD hearing aids I gifted her, she was back to her storytelling best. She's a published author, longtime Byline columnist. Many of you have heard me talk about her in the past. She's a poet. So storytelling is her thing, and she was able to return to this, being back in the mix with all of us as a result of being able to hear better. The Not Old Better Show is proud to partner with MD Hearing. They're doing phenomenal work with their Neo model. The Neo model is MD Hearing's most discreet aid, yet designed to be so comfortable and unobtrusive you'll forget it's even there. The best part? MD Hearing has recently slashed their prices by 50%, making their already affordable devices an absolute steal at just $297 per pair. And remember, these aren't just hearing aids. They're the fruit of an ENT surgeon's dedication to making hearing help accessible to all. I'm a fan, and not just because I've seen the change in my mom. MD Hearing stands for quality, affordability, and a mission that resonates with anyone who believes in the importance of hearing well and connecting to others. That's what I saw in my mom. MD Hearing has sold over 1.5 million hearing aids, and they offer a 45-day risk-free trial. That's confidence you can hear. And for the icing on the cake, as a Not Old Better Show listener, you get an exclusive offer. Go to shopmdhearing.com. All this will be in our show notes. Use the promo code NOB for the $297 pair offer and snag a free extra charging case, a $100 value. That's shopmdhearing.com, promo code NOB for sound savings that you'll have to hear to believe. With MD Hearing, affordability meets innovation, and I couldn't be happier to recommend them. Now, let's get back to our episode, our interview on AI and healthcare with Meryl Davids-Landau. And remember, hearing well is living well. Meryl Davids-Landau is our guest. Meryl Davids-Landau has an upcoming article in Prevention Magazine, the May issue, titled "Hello, Dr. Roboto, about AI and Healthcare," a fascinating area, one that I think our audience will hear much more about. We're learning about it today from Meryl Davids-Landau, a returning guest. Maybe tell us, Meryl Davids-Landau, a little bit about some of the examples that you came across where there's been a direct benefit. I mean, you referenced, kind of a bilingual, patients better understanding, grasping some of the medical history. Tell us a little bit what you came across in terms of actual benefits to patients or even doctors with regard to AI.
So again, a lot of the direct uses outside of imaging, which I think we'll talk about in a minute separately, because I just want to kind of give an overview first. But a lot of these other benefits are in the earlier stages. But for example, think of scheduling, right? That's one of the hardest things for doctors and hospitals to do. You have an appointment for the emergency room, for the operating room. I mean, I think anybody who's had an outpatient surgery scheduled, for 10 o'clock in the morning, and you're still sitting there at 3 in the afternoon waiting to be taken in, right?
Yeah.
And why is that? That's because it's very challenging to schedule how long is this surgery going to take, and what are the other factors that could influence all of these things. And AI, really what AI is, I think we should step back for a minute and say, what is AI? So artificial intelligence is intelligence in the same way that people are intelligence, right? It's just computerized tools that try to solve problems by using data and then learning from that data. So it's the learning from that data really that makes AI a little different than computerization in general. But so AI learns how long does it take patients with these kinds of complications to have this kind of surgery? How long does it take this particular doctor and nurse and anesthesia physician and all of that? Like, how long does it take these teams to do these kinds of doctors? Like, all of that really minute information are things that AI can learn and then use that going forward to schedule patients. I think that kind of thing would be much more accurate. Also, when you think about when the doctor says you should have this follow-up test, nobody ever really calls you to say, did you schedule this follow-up test, right? Because there are so many follow-up tests in the system, no one can keep track of that. But a computer could keep track of that and alert the physician, you still didn't have this, or potentially alert a robocall to call you and say, please schedule your whatever. So I think just even things like that, the small things that fall through the cracks in healthcare, some of which are very important, but they seem small. Those are the kinds of things that could be helped greatly. In addition, as we talked about, to the note-taking. The note-taking is also very important for doctors, because if you think about it, what if a doctor, 2 minutes before they walked into your room, could say to the AI, provide me a summary of the most important things about this person's health over the last 5 years. And they read that before they walk in to talk to you. That's very different than now the doctor's walking in with so much background material on you, they can't sift through it. So these are things that potentially make AI very helpful for patients.
The other area, and you cite this in your article, Dr. Roboto, in the May issue of Prevention Magazine, you talk about reading medical images and that somehow the accuracy is surpassing the humans that have been to the human professionals that have been the diagnosticians that have been looking at these same images. Tell us a little bit more about that and how that technology in particular has really made some leaps and bounds in terms of patient care.
Yeah, so what I learned when researching this article is that imaging is really the area where AI has been used most extensively and has been documented as being most effective. And when you think about it, that makes total sense, right? I mean, again, if we talk about that AI learns from so much past data. So if they're reading a mammogram or they're, reading a MRI, cardiac MRI, the computer program has all of the history of what's abnormal. And so it's easy for AI to flag, this looks different than all of the normal tests that, they've seen over the years, based on being fed all of those images and being told that they're accurate. So it's being used definitely in conjunction with radiologists. AI doesn't replace radiologists. And in fact, the research has showed, AI plus a human reading these results does much better than either one alone. So I don't think the thinking anytime soon is that one would replace the other. But when you have a colonoscopy, for example, there's an AI program that's out there that doctors are using as they're looking at the screen while the colonoscopy probe is advancing. Areas light up on the screen. Pay attention here. Pay attention here. These are potential problems. That helps the physician a lot more than if they're just on their own having to look through your entire colon. So things like that, diabetic eye screening, people with diabetes have to be screened for eye disease regularly. And, the AI program would be looking for very specific things related to diabetes that could be flagged much, much more easily, eliminating, some of the people who are missed when they get that. And then potentially down the road, and this is more in the exploration stage, I got the sense that treatments eventually could be recommended based on all of the imaging data. So a patient might have an MRI and a CT and EKGs and all kinds of other tests, and it could fall to computers to kind of synthesize based on a lot of patients with these same conditions what treatments seem to work best for those patients. And there was a study about patients with stroke where the AI was able to recommend a certain portion of those patients try this, should try this type of treatment.
One of the challenges that certainly I gathered as I was reading your article and doing the research, on this subject prior to our conversation was that there's a cost function here, as there is in healthcare. There's a, have and the have-not kind of scenario. Tell us a little bit about this cost issue and maybe any other obstacles that you came across that are going to lead to, more of a gulf, more of a gap perhaps in patient care. And, some of the bigger medical centers might have AI, but maybe some others, might not. And I could be wrong about both of them.
Yeah, I think cost is definitely going to be a huge issue. And again, that's where, maybe we could save money by limiting how many physicians patients can see. Like that's where cost could potentially even exacerbate inequities. But I think also potential pushback from people who are concerned about AI, government that's concerned about AI, right? I mean, the advances technologically may be ready to move forward more quickly than regulations allow it to move forward. Again, the FDA has to approve a lot of these programs that deal with patient care. That potentially could move slowly because of concerns, and many of them legitimate concerns. So it definitely, the AI is definitely already in healthcare. It's coming more to healthcare, but it's not going to happen overnight. One of the doctors I spoke to said in 20 years, AI will be embedded in almost all aspects of healthcare. And I think that's true, but it's also in 20 years, not in 2 weeks. Or by next year, I think it's going to take a little while.
I see the value definitely on a very, a specific individual by individual, kind of the micro level. But what about in the macro level? Would AI, because you do talk about this a little bit in the article, will AI be able to identify early outbreaks of contagious diseases? Could it spot a COVID before the COVID really occurs?
Again, it gets back to what is the data that's there, right? AI doesn't think for itself. It learns from what people are feeding it. And so Black people historically have had so many interactions with the medical system that have been, contaminated by prejudice. They're offered fewer treatments. They have less access, less insurance. Doctors used to think Black people experience less pain, right? So they were prescribed fewer pain relief down the road. And a lot of these kinds of biases are true of, Latinas and women as well, right? Women have complained about things for years that they're not taken seriously by the medical profession.
Sure.
So all of that is, again, baked into the data. So there was a study that tried to assess, how much does this racial bias affect what the AI program is going to be recommending. And so it asked the AI to identify patients based on a lot of, past historical records of patients who potentially is going to use a lot of healthcare going forward, so that those people could be referred to a care management program to control their condition. So maybe they wouldn't use healthcare as much going forward, right? This could be a way to help keep them healthier and minimize costs to the healthcare system. And fewer Black people were flagged. And it kind of makes sense when you stop and think about it. It's not that that fewer Black people are going to need more care than white people. It should be proportional to the population. But the algorithm was using past medical visits as a proxy for future need. How much has this person used healthcare in the past? Well, if you put a lot of barriers to access to care on a community, of course they're going to use less care in the past. So that doesn't mean that they are not going to need more care in the future. It means that they didn't use it as much in the past. And there are, kind of a lot of stories like that where past biases and past thinking is going to be part of the historical record that AI is evaluating.
Meryl Davids-Lando, it's always so nice to talk to you. This upcoming article in Prevention Magazine is must read, and I think our audience is just really going to enjoy it. I just really have one final question for you about kind of your general perspective of this technology going forward. What are you really seeing on the horizon in terms of the development of AI technologies in terms of healthcare? What is the kind of the most promising development that you see looking ahead?
I mean, I think in the future, AI, in addition to, of course, continuing to be used along with physicians for imaging, scheduling, all of the other things we talked about before. But, I start my article by talking about Star Trek's tricorder, right? For those of us old enough to remember, yes, Dr. Bones used to run this little device over a person, and it would know what was wrong with them, but importantly, it would also recommend what to do about it. And I think that it's so intriguing to me to think that based on so much data that we have in the medical record, that AI could start to help individual patients. You have these symptoms, these test results, you've tried these treatments, you've had these results from these treatments. I mean, they have that information on you, but they have that information on millions of Americans. And people around the world. And so if the computer could get to the point where it can take all that information and figure out what course of treatment would work best for someone in your exact situation, because it's worked best for people across the country and across the world in those situations. I mean, to me, that's really intriguing. But it's really important that computers continue to be used to help physicians make decisions and not to replace the physicians who are making decisions, because I think that computers can never have the nuanced thinking and the patient-specific knowledge that your doctor's going to have.
Renowned health, science, and medical writer Meryl Davids-Lando has been our guest again, a returning popular guest with our audience, giving us a glimpse into this fascinating world of AI and healthcare. Great deal of hope, but caution it with understanding yourself about participating with your healthcare provider to get to get the best out of what AI might offer with respect to healthcare. Meryl Davids-Landau, thank you for your time. I know we'll be talking again, but my best to you, and congratulations on just another wonderful article. We'll have links so that our audience can find out more about Meryl Davids-Landau and her work in fiction, as well as all of the work that she does for National Geographic, Washington Post, Prevention Magazine, and others. But Meryl Davids-Landau, thank you. Have a great rest of your day. We so appreciate your generous time.
Thanks. Great talking to you.
My thanks to MDHearing and TalkSpace for sponsoring today's show. The Not Old Better Show Prevention Magazine interview series on radio and podcast. Let's talk about better. The Not Old Better Show. Thanks, everybody. We will see you next week.